Hello again. I'm Dr. Thomas Gerber, Associate Editor and Web Editor at Mayo Clinic Proceedings. I'm also a Professor of Medicine and Radiology at the Mayo Clinic College of Medicine. Here I am once again with a summary of Editor's Choice and Highlights articles, this time of the March 2016 issue of Mayo Clinic Proceedings. As you remember, these are the articles that you can access on our website for free, at least during the month of March. Some of the articles are even free for 60 days for you to read. Our editor's choice this month is the original article entitled The Natural History of Non-Obstructive Hypertrophic Cardiomyopathy, which was authored by Dr. Virginia Hebel and colleagues from the Minnesota and Florida campuses of Mayo Clinic and the Centro Medico Diagnostico in Naples, Italy. The authors identified 706 patients from the Mayo Clinic Hypertrophic Cardiomyopathy database for a retrospective observational study. Interestingly, after exclusion of patients with ICDs, patients with non-obstructive hypertrophic cardiomyopathy had similar survival rates compared to age and sex-matched white U.S. population mortality rates. However, presence of so-called burned-out hypertrophic cardiomyopathy was independently associated with increased risk of death, and these might be a subset of patients that would benefit from more aggressive therapy. One of our highlights this month is a review article on the epidemiology, diagnosis, and treatment of head and neck squamous cell cancer. This article was written by Dr. Shanti Marur and colleagues from Johns Hopkins University in Maryland. The authors point out recent changes in the epidemiology and diagnosis of virus-related head and neck squamous cell cancer and the special role of human papillomavirus in the etiology of oropharyngeal squamous cell cancer. They also review the current standard of care management of locally advanced oropharynx and larynx squamous cell cancers. This article is part of our ongoing symposium on neoplastic hematology and oncology, and you can get up to 1 hour of CME credit for reading the symposium article if you complete the appropriate documentation as usual. Our second highlight this month is the latest contribution to our ongoing symposium on pain medicine. Drs. James Watson and Paola Sandroni from the Mayo Clinic in Rochester review central neuropathic pain syndromes. This article focuses on unique clinical features that help distinguish central neuropathic pain from other pain syndromes. The authors also discuss recent progress in the understanding of the pathogenesis of central neuropathic pain, and they present a practical discussion of pharmacologic, surgical, and neuromodulatory treatments of this notoriously difficult to treat form of pain. You can find these and many other free articles on our Mayo Clinic Proceedings website at www.mayoclinicproceedings.org. If you connect with us on Facebook, Twitter, or YouTube through the icons on the upper right-hand corner of our homepage, then we can keep you up to date on what's being published online first at Mayo Clinic Proceedings between the monthly issues, and maybe which recent news stories have relied on material that was published in Mayo Clinic Proceedings. And before you know it, it'll be time to share the highlights of the April 2016 issue of Mayo Clinic Proceedings with you. So stay tuned. Thank you.
We hope you found this presentation from the content of Mayo Clinic Proceedings valuable. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you are interested in more information about us, our homepage is www.mayoclinicproceedings.org. There you will find access information for our social media content, such as additional videos on our YouTube channel or journal updates on Facebook. You can also follow us on Twitter. More information about healthcare at Mayo Clinic is available at www.mayoclinic.org. This video content is copyrighted by Mayo Foundation for Medical Education and Research.